Now we'll study about the drug-induced overgrowth of gingiva. Let's start it. Bismillahirrahmanirrahim. Before we start, due to inflammation, the gingival growth. But today we'll the drugs that cause the gingival growth. Okay. Now most common forms of drug-induced overgrowth of gingiva is anticoagulants, calcium channel blockers, and immunosuppressants. Immunosuppressants. Okay, so basically, these three groups of drugs cause the gingival overgrowth. Okay, like anticoagulants are used for epilepsy, calcium channel blockers are used for hypertension, and immunosuppressants are used for the organ transplant. It is given to those patients. The drugs which is belong to this is like phenytoin, which is anticoagulant, nifedipine is a calcium blocker, and cyclosporine is an immunosuppressants. Okay, basically about 80 to 30 to 80% of these patients by using these medications has the overgrowth of these lesions. But genetic factors, dosage, local factors also affect the development and severity of the drug induced gingival overgrowth. But with this, the impaired oral hygiene means he is not taking care of our oral cavity, biofilm accumulation, and gingival inflammation. When there is an increased prevalence of gingival infection and inflammation among these patients, so they have also the risk for their general health. Mean it can affect their general health also, but these drugs can also be replaced with alternatives, but this is the drug of choice in many countries for their specific conditions. Okay, now basically drug induced gingival overgrowth usually develop fast and become chronic over the time. Means it is the development is very fast. The first sign you can see in their early as 3 months of drug use. When the patient is using lifenitine for 3 months, so you can see the first overgrowth as a localized nodular enlargement of the interdental papilla. Okay, you can see here. Okay, like you can see the patient has used the drugs for almost 3 months, and there is a nodular enlargement in the interdental papilla. Okay, look at. Because most of the medications are associated with this drug-induced gingival overgrowth are prescribed for for an extended time. Means it is also for a very prolonged time. That way, so the lesion is exposed, and some cases covers the crowns of the teeth. Also means if you does not stop these medications, it can also lead to cover the whole teeth. Okay. Several forms of drug-induced gingival overgrowth may result in complete coverage of the dental surfaces. Okay, you can see this. It is covering almost all like lingual surfaces of the teeth. Okay, you can see here. It is very like it has covered the whole. Like you can see no, the basically due to the drug usage, the gingival or growth has been happened, and it has covered the whole dental surfaces. Okay, now clinically, there are subtle differences in how the lesions manifest depending on the type of medications. Means these are three different type of medications, and they can cause three different types of growths. Okay, so dental biofilm and bacterial infection frequently lead to the inflamed tissues characterized by edema and bleeding. How can you basically characterize whether it's edema and bleeding? Okay, now, the degree of fibrosis means an inflammation also depend that the drug usage for the duration and what type of drug is this. Okay, oral hygiene, individual susceptibility is very important. Means and then genetic factors and environmental influence is very also important on the same time.